Welcome to another episode from the Veterinary Research Channel. Today's topic is a deep dive into a study that explores how illnesses, not directly related to the thyroid gland, can influence thyroid function tests in dogs. This condition is known as nonthyroidal illness syndrome, NTIS. The study, authored by Timothy A. Bolton and colleagues, was published in the Journal of Veterinary Internal Medicine in 2024. Have you ever considered that a dog's sickness might lead to misleading thyroid test results, even if the thyroid itself is healthy? This research investigates this scenario, offering valuable insights for both veterinarians and dog owners. The central aim of this research was to monitor changes in thyroid hormone levels in dogs suffering from acute illnesses and to determine the time it takes for these levels to return to their normal state. The researchers focused on measuring total thyroxine, free thyroxine, total triiodothyronine, and thyroid-stimulating hormone concentrations in dogs affected by NTIS. To carry out the study, the researchers initially examined 103 dogs, focusing on 25 euthyroid dogs that had acute, resolvable illnesses and a low total thyroxine concentration when admitted. These dogs were closely monitored, and thyroid function tests were conducted at regular intervals, starting from admission until discharge. Follow-up tests were then performed 2 and 4 weeks after the dogs were discharged. The concentrations of different thyroid hormones were measured in the collected blood samples. The study revealed that NTIS does indeed cause significant changes in thyroid function tests. At the time of admission, total thyroxine and total triiodothyronine concentrations were below the reference interval in most of the dogs. Free thyroxine was also low, but this was seen in fewer cases. Thyroid-stimulating hormone levels were, however, mostly normal upon admission. As the dogs got better and were discharged from the hospital, some of the hormone imbalances began to correct. However, it wasn't until 2 to 4 weeks after discharge that most thyroid hormone levels returned to normal. The researchers determined that measuring total thyroxine 2 to 4 weeks after discharge, or measuring free thyroxine using equilibrium dialysis during the illness, provides the most accurate way to assess thyroid function in acutely ill dogs. These findings indicate that relying on a single thyroid function test in a dog with an acute illness can lead to a misdiagnosis of hypothyroidism. Given that NTIS can resemble hypothyroidism, it is important to reevaluate thyroid function once the dog has recovered from the acute illness. The study also explored the possible mechanisms behind these hormone changes. The researchers suggested that reductions in total thyroxine and total triiodothyronine concentrations might be caused by suppressed hormone secretion at various points along the hypothalamic-pituitary thyroid axis. In addition, the body's capacity to convert thyroxine into triiodothyronine might be impaired during illness. Interestingly, the study indicated that impaired protein binding to thyroid hormones in the blood does not significantly contribute to the thyroid hormone changes seen in dogs with NTIS. Instead, concurrent increases in thyroid-stimulating hormone, total thyroxine, and free thyroxine are more likely linked to increased hormone production or decreased deiodination resulting from impaired cellular uptake. The practical implications of this study are noteworthy. The researchers recommend that veterinarians should avoid measuring total thyroxine concentrations until 2 to 4 weeks after a dog has been discharged from the hospital following an acute illness. If it is essential to evaluate thyroid function sooner, measuring free thyroxine using equilibrium dialysis is recommended. This strategy helps prevent incorrect diagnoses and unnecessary thyroid hormone supplementation in dogs who are euthyroid but affected by NTIS. The scientists took several factors into account when designing their study. They excluded dogs with chronic illnesses, dogs on medications known to affect thyroid function, and specific breeds known to have naturally lower thyroid hormone levels. Despite these precautions, the authors did recognize some limitations. For instance, some dogs underwent surgery involving anesthesia, which can have temporary effects on thyroid hormone levels. However, they took steps to minimize the impact of these effects. The study concludes that a decreased serum total thyroxine concentration can easily result in a misdiagnosis of hypothyroidism in dogs with NTIS. Therefore, it is best to wait 2 to 4 weeks after a dog is discharged to measure total thyroxine. If earlier evaluation is necessary, free thyroxine measurement using equilibrium dialysis is less likely to be affected by acute illness. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.